Assalamu alaikum wa rahmatullahi wa barakatuh. Dear brothers, Jazakumullah khairan for coming to this session. As we know, this is very important session. It's a part of the series that we have started recently, and we are very grateful to Dr. Nasir Mirza. MashaAllah, he took this initiative to start this. And MashaAllah, it has been an excellent opportunity for Darussalam, for our team, and for our local community as well, to interact, to participate in these sessions. So, Alhamdulillah, so far we had wide range of sessions. So again, today's session is part of that series. So inshallah, Aziz will start shortly. Before we begin this session, just to remind you about the safety instruction, fire safety rules. Here, Alhamdulillah, Darussalam is equipped with the fire equipments in case any emergency happens. And as you enter through the front entrance, that is the exit as well. And we have the second exit onto your left through the stairs and through the further doors out in the yard. That is the assembly point. So as such, we don't have any fire drill if buzzer goes off. So understand this is real. But we have Brother Siddiq. He is our fire marshal. Inshallah, he will guide you. So we hope, inshallah, Aziz, nothing happens as such, and our session runs smoothly. So to begin this session, Alhamdulillah, we have a great team here, along with our, the trustees, our management. We have been blessed by Allah Azza wa Jal that we have many professionals, almost in every field. And as I mentioned, Dr. Nasir Mirza, mashallah, he took this initiative, and we started these programs. Along with that, we have Dr. Muhammad Azhar. He is a general practitioner, and he was the forefront to organize this session. And mashallah, it has been organized very well. And we have session for the sisters in the basement as well. And we have been supported by a trained, BLS trained team from BMI, Beardwood Hospital. One of the instructor who is trained, her name is Catherine. She is downstairs giving this training to the sisters. And we hope all the session goes smoothly and we have good outcome as a learning outcome that we can impart to our community. Jazakumullah khairan for coming and attending this session, and we hope more brothers, they can join us here as well. So to begin with, as I mentioned, we have Dr. Nasir Mirza as a part of our team. Dr. Muhammad Azhar is general practitioner. Brother Abdul Salam from St. John Ambulance Service. MashaAllah, he organized everything. Basically, he got full family of mannequins that you will be entertained with. MashaAllah, so he's getting everything ready. And myself, my name is Dr. Muhammad Saeed. I work in Royal Lancaster Infirmary. So, as you have seen the poster, which is titled as Save a Life, which is the main theme of this session. As we all know, how sacred is the life, as we know it has been mentioned in Quran. Allah subhanahu wa ta'ala, he makes mention, and whoever saves a life, it will be as if they saved all the humanity. Here, we need to put our effort. It's not that we're going to make a huge difference, but we try our best, whatever we can achieve, and we can contribute. We could ask Brother Siddiq to. Sorry, some interruption. Basically, mic is not turned off for the downstairs. Okay, so we can restart. So, as Allah Azza wa Jal stated in Quranul Kareem, whoever saves a life is like he's saving the whole humanity. And as mentioned, as a human being, we just try. We try our best to facilitate this, and life is from Allah Azza wa Jal. And as we know, life and death is written, and death is essential. And if that time is not written at that time, your contribution will make a difference. So just keep in mind, like, the whatever will have this training today, we will utilize at some time in our life, maybe within the family, within the community, you're on holidays anywhere, you may be asked to help. So if you have training and you know basics of it, it's quite easy. So we have delivered previous sessions so far. The first session was brain health. Dr. Nasir Mirza, mashallah, he detailed that session. The second session we delivered for the brothers and also for the sisters. That session was the right way to lose weight. And again, this session, Save a Life, inshallah, will carry on today. And our next session is happening just before Ramzan Mubarak, which is Ramzan and fasting, especially for the brothers who are diabetic. I believe, like, the almost every family has, someone who is diabetic. So even attending this session, if you are not diabetic, will be useful to instruct your family members. So just keep an eye on that poster. Inshallah, it will be released soon. So today's session, we've seen aims and objectives. The most important is cardiac arrest and heart attack. We are not going to go in too much details of it. It's just very basics, because this session is about, the basic life support. And you are not going to provide, the advanced care. It's just initial, the supportive aspect. And we'll look through what are the causes of cardiac arrest and what we should do in the event of cardiac arrest, and what CPR, or basic life support, is, and how we can carry it out. And also use of AED, which is automated device, external defibrillator, that is very useful if it is available, and if you know how to use it, again, that could basically make a huge difference. And then we'll go through some of the algorithms, how to perform CPR, how to carry out different maneuvers, and we'll give you a summary of it. So how many of us know what cardiac arrest is? Any brother who would like to, especially from the youth? Yes. So basically, when we say heart attack is different, and having cardiac arrest, that is totally different. Heart attack may be just chest pain, where the artery, one of the arteries supplying to the heart itself, is blocked, is narrowed, which basically heart needs blood flow. And as a result of that lack of blood flow, we get the chest pain. So that could be heart attack, maybe early symptoms of the heart attack. You can say these are the warning signs of the heart attack. When we talk about the cardiac arrest, it doesn't mean heart attack. Cardiac arrest, when your heart ceases its function. I'll just give you a simple example. Suppose you're irrigating a field, and your water pump is running on electricity. Suddenly you switch off. What will happen? There will not be any water coming out. So that's the way. heart itself has got internal stimulus which coordinate the function of the heart. So the internal stimulus that seizes function, maybe there is effect on it, and it stops functioning. So there is no flow of blood out of the heart or towards the heart. So it's total cease of the function of the heart. So it's kind of standstill situation where there is no output from the heart. Our whole body is dependent on that blood flow. Our brain, our kidneys, our lungs, any part of the body is dependent on that blood flow. As soon as heart ceases function, that is a cardiac arrest. So I put two things here. On the right, basically there is a problem of that electrical stimulus within the heart which ceases and heart function ceases. On the other hand, left side, you see the yellow area, which is the cholesterol deposits within the artery. And as it closes down, blood flow becomes less and less, and it can be blocked fully. So in cardiac arrest, person will be unconscious. There will not be any response. On the other hand, when there is a heart attack, person may be well alert, may be feeling unwell, but you should still be able to talk to the person, communicate with the person, will be breathing. So these are the differences. So when we talk about, the heart function itself, when it supplies the blood, we talk about cardiac output, which means whenever your heart beats, it supplies specific volume to the whole body, just to irrigate the whole body. In simple terms, you can say. Like in each second, it throws out maybe 70 to 100 ml of blood out, which goes through the vessels and irrigate every organ within the body. So on this side, when you see this heart function is ceased, there will not be any blood flow coming out of the heart. So now here, your early intervention, that is very, very important. So in a young, healthy person, our heart beats maybe 70 to 75 times per minute. So in 0.8 seconds, there's one heartbeat. So in 60 seconds, approximately 78 to 80 heartbeats. And in each heartbeat, it will give out maybe 70 ml of blood or maybe 100 ml of blood. It depends on how your physique is. And in children, there is less volume of blood that goes out, but their heart rate is a bit fast as compared to adult. So their physiological reserve, their blood volume is also less as compared to adult. So in each minute, our heart supplies approximately 4.5 to 5 liters of blood to our body. And subhanAllah, it is a constant, persistent function without even our awareness what is happening within our body. So this is very, very important to understand. So in 1 minute, you imagine 5 liters of blood flowing to the body. Now, when heart function ceases, there is no flow. So your BLS, your basic life support, is to, the work on that flow, to give some aspect of it so that circulation is maintained. The function of the brain, we need to keep it in healthy status. Similarly, other organs as well. So as we know, cardiac arrest, there could be numerous causes. The most common, as our youth mentioned about the heart attack. Heart attack, when it happens, it could be total blockage of the artery, and within minutes, within hours, that part of the heart muscles that may be dead if we don't intervene. If patient doesn't seek the intervention, doesn't seek the medical advice, goes to the hospital. So when there is lack of blood flow, that part of the, the heart muscles, they become, we call infarcted. Basically, lack of blood flow will cause the damage to the muscles. On the other hand, if we don't seek medical advice, it can go in failure. And again, these are the precursors for the cardiac arrest. Similarly, when there is a heart attack, there is very high chance that your heart can flutter, can go with abnormal rhythms, abnormal heartbeats. Again, that can lead to the cardiac arrest. And on the other hand, many people, they do have, the irregular heartbeat, abnormal heartbeat. If it goes very fast, they can lose their cardiac output, the volume blood that goes out of heart, they lose that because heart is beating too fast. It doesn't get that time to fill in and hasn't got that much volume to supply out. So there is a mismatch of this. Similarly, many people have congenital heart diseases. Again, trauma to the chest, direct trauma to the chest, blunt trauma, that can also cause cardiac arrest. But again, there could be rupture of the vessels as well if something hit onto the chest. Again, we see in the common cause of the cardiac arrest is breathing problems. We see severe asthma, again, the chronic lung diseases, which are quite common in this community. On the other hand, in children, choking incident could lead to the cut off, the breathing, and this choking incident, due to the lack of oxygen flow, leads to the cardiac arrest as well. Similarly, drowning, we have, the fire incidents, all these things, and electrocution that can cause cardiac arrest. So we'll go through in, the some of these, the minor details. So as I mentioned, cardiac arrest itself is the main presentation when we see person is collapsed, is not responding. On the other hand, there is no breathing effort. It's totally unconscious. So you don't get any response out of it. That's a cardiac arrest. And it is the leading cause of death. Why it is leading cause of death? Because lack of abilities of the bystanders to intervene. If bystanders, they are able to intervene, then their survival rate is much better as compared to those people when there is a delay in intervention. Okay, so early recognition and prompt intervention, it improves the survival. So as such, this session is very important for every one of us, whether we are in youth, in adults, or in late ages. At some point, our skills will be needed. So what is CPR as such? Any one of our youth? Have you done any session in the school? So CPR itself, in other words, you can say basic life support is cardiopulmonary resuscitation. Cardiac means heart, pulmonary means your lungs. Resuscitation, that your efforts to revive them. So basically your main focus is on the heart. When you revive your heart, then it will establish circulation towards the lungs and lung function can be established. And gaining consciousness, that's usually delayed after recovery. So CPR itself is a basic first intervention, first aid, you can say, to keep this person alive. Because if you don't intervene within minutes, that person will be dead. And 10 minutes, brain will be dead because there is no flow. Heart is in standstill, blood flow doesn't go out, no circulation goes to the brain, and brain becomes dead within 10 minutes. So your first 10 minutes are very, very important. Okay, so how to recognize this? We see your hair, like you see someone suddenly collapsing, and first thing what you do, you ask them, are you all right? Ask them like, what's going on. If person is not responding, that's the first thing you need to pick. Second thing, whether person is breathing. If person is not breathing, that's the second thing, sign of the cardiac arrest. On the other hand, you look for any sign of life, any movements in the body, any movements on the chest, any breathing effort. If nothing is there, that means person is in cardiac arrest. So here, I'll ask Brother Abdul Salam as well to come here, please. So as soon as you see the person is collapsed and you confirmed, person is not responding, there are no sign of life, that is cardiac arrest. And you immediately shout for help. And if you are in doubt, then anyone around you, ask them to help you, to assist you. But time is very, very critical. You have seconds to assess that this person is not responding. And if you know he's not responding, without any hesitation, jump on the chest. If you know this person hasn't got any, the DNA CPR, mean any advice which already been agreed with the clinician that no one should jump on the chest, your responsibility as a community member, as a bystander, is to jump on the chest, do the CPR that we will inshallah teach you. Your CPR may bring a response from that person. If he's still alive, that person will not allow you to do the CPR. At least you will check that response. That's very important. And other aspect, when you approach any person who is collapsed, first thing you need to see, you need to make sure you are out of danger. Don't put yourself in danger, because we don't want another victim of the same situation. And look for any hazards. If there is a hazard, if you feel it's safe to pull that person away from the hazard, do it. And further assessment you can do in a safe area. And we know, like in public places, safety equipment, they are not usually available. So it's difficult to find that. So first thing, when you find a person is collapsed, think about, is it safe to approach? So your own safety, your personal safety is important. And check patient's response. How to check the response? Brother Abdul Salam will demonstrate.
So this is just, so you find somebody collapsed. What's the reason for the collapse? What's that wire doing? What is it? Is it an electric cable? Has he been electrocuted? Has he fallen off ladders? Has he fallen off a chair? So first and foremost, endanger yourself, the doctor said. So we need to make sure we isolate that. So we need. Sorry. So isolate the source of the electricity, or whatever it may well be, or there may be glass. So we need to clear that. So you don't want to become a casualty, and you don't want to further injure the potential casualty there as well. So first, we need to make sure, utilize people as well. So if there's someone there, do you know where the electricity board is or the meter? Can you switch the electricity off? Because we don't know if that is going to a continuous cable, which is live, we don't know. So we need, before we approach, danger. Make sure you don't fall into it. Next, response. Can you hear me? My name's Abby from Northwest Ambulance. Can you hear me? So we check for a response, see if they speak back. If not, shake the shoulders. Yeah. So, can you hear me? Okay. So you need to check that there is no response before the next stage. So there's an acronym which we follow, DRSABC. So we've done danger, response, we've had no response. So I need some assistance. So help. You're nearby. So use the person or people nearby and utilize. So can you please come over? I need your assistance. Yeah, that's okay. And then so DRS, so shout. So now you're going to use this person as your right hand. Okay, so you've got somebody else, so you're not on your own. Sometimes you're on your own, it's fine, there are ways you can do it. You've always got your mobile. Everybody's got the mobiles, so you can use your mobile. So you keep it alongside with you at all times. So first and foremost, most important is the airway. So how do we check the airway? So first of all, airway is what we call head tilt, chin lift. So what that does, it opens up the airway. So I'm just going to demonstrate. So head tilt, chin lift, and we're checking and making sure we bring a neutral position to the airway, which opens up, okay? So that we can check. So now we're going to check for breathing. So how do we check for breathing? Okay, so there are 3 elements. First of all, you need to go down, low down, and put your cheek where the mouth is so you can feel the breathing, if there is any breathing. Okay, so you're going to put your cheek right up here, and at the same time, you're going to look down the plane of the body, okay, to see any rise and fall. And at the same time, you're going to use your hand, the back of your hand, because we have to also, you know, be mindful and be dignified, etc., and protect the patient. So we're going to check for the rise and fall. At the same time, we are looking, watching, and listening and feeling at the same time. So you're doing all those things, and it's only for 10 seconds. So what you do is you count 10, 9, 8, 7, 6, 5, 4, 3, 2, 1. Now then, a person normally breathes in 10 seconds, 2 to 3 breaths. If you're not getting any of those, then this person has basically collapsed. Okay, so there's no breathing, so we're going to do that for them. So DRS, airway, we've checked the breathing for 10 seconds, now we're going to start the CPR. So the C is for CPR. So here we go. So we're happy with that. So
just a moment, please. Let me have a little intervention. So, alhamdulillah, this is very, very important. Look, listen, and feel. Don't be afraid of, like, you know, doing this. You are in critical situation. You have to recognize that this person, this patient is critically unwell, is not responding. So your closeness of your cheek to the face, that's the way you can feel even slightest of breath. That warmth feeling of the breath, you will feel on your cheek. Again, you can put your hand on the chest just to feel the movements, and you will not feel. On the other hand, for the clinician, we do feel the pulse, but you don't need to do any pulse check as such. You just need to look at the movements of the body and feeling the breath. And at the same time, call 999. Put it on the speaker. The person at the other end of the phone will guide you what to do. And from there, your actual intervention, they start. Now, inshallah, we'll go through further. So you have got the leaflet. Everything is described.
So CPR, performance of CPR. We are looking at the center. It doesn't matter how old they are, who they are, age, etc. There's slightly difference with the babies and pediatrics. We'll bring our Dr. Hussain, and we might as well utilize our best qualified person to do it. So the center of the nipples and center of the chest. So basically, we place our palm, heel, into the center there, interlock with the other. Again, if you can't do that, don't worry. There are other ways I will show you, but I will show you one method, which is interlocked, heel, into the center, and you need to press. Okay, so it's press, one. And you need to get your body over the patient, okay? And you're not using, and lock your arms out at the same time. So you've got this position, lock your arms out because you're using the rocking motion to actually create the compression. And you're pressing 5 centimeters, 2 to 3 inches. So because the body, the heart is enclosed in this rib cage area, okay? So, and sometimes you will feel crunch, that's breaking of the ribs, that's perfectly fine. It's not a problem, don't worry. If you haven't broken them, you're not doing CPR right, okay? So Don't worry about that. You will always, more often than not, break the ribs. And I've broken so many. So don't worry, it happens. If you haven't broken them, you're not doing CPR right, and you're not going deep enough. At the same time, so you need to press, compress. Okay? So 2, 3, 4, 5, 6. And you're going to do 30, okay?
Thank you.
If-
Thank you very much. So while we'll demonstrate this, if you look at this slide here, can I have that one? So as Brother Abdul Salam, he explained where to put your hand. If you look at the first picture, which is the adult, again, that is a nipple line, where your heart slightly onto the left, but your position is need to be on the chest bone, which is right at the center. So lower third, center of that bone is, give you exact position where you need to press. So again, for the children 1 to 8 years of age, again the same position. If you see the infants, almost the same position, because their physique is very small as such. So again, position is same. That is where our heart lies. Very, very rarely we see the heart orientation is other way around. But again, that is very, very uncommon. Okay. So these are the position. The second point where where we start the compression, how we interlock our hand. So if you see your one hand, your heel of the hand goes in the middle of the chest. Yeah. So when you see that, you have to interlock your fingers like this, because this hand will give you more strength to push on it. So you have to interlock your fingers. And for the children, you can use just one hand, but you have to use, the fist, which will give you enough pressure. And for the little babies under the age of 1, you need to use 2 fingers. So this cardiac arrest can happen to anyone. It doesn't mean like, that it's only for the people who are, the late age. It can happen at any age. So I will request brother to explain about, the pediatric area, just basics, please.
Yes, Assalamu alaikum everyone. Yeah, thanks for joining in. So my name is Dr. Hussain. I'm a pediatrician working in Lancashire. And the first thing that I think Brother Abi and our doctor actually explained all the most important things that we need to be doing in a CPR situation. But as a pediatrician, the first thing that we are actually told is that children are not little adults. So that speaks a lot. Children are not little adults. What that means is that we will not be, because the anatomy, everything is actually so unique about the child that we have to do things a little bit differently for them to get a really good outcome. So in children, we actually have 3, we like to actually put them in 3 groups. We call a baby who's just born and up to 4 weeks, we call that a neonate. And beyond 4 weeks of age, up to 1 year, we call the baby as an infant. Oh, thank you. Thank you. And any child above 1 year of age, up to 18, is actually a child. So when we need to do, when we are in a cardiac arrest situation, one of the things that is very, very different to adults is that in babies and infants and child, the cause is actually a breathing problem rather than a cardiac problem. However, if we are in a situation like now, where we have a baby, where we have an infant who is actually not breathing, and is actually lifeless. Like Brother Abby said, the three things, if you remember, look, listen, and feel, that is actually, very, very, very important. And once we establish that there is no breathing and there are no signs of life, we just start CPR. So for an infant, we would start by rescue breaths. So we give 5 rescue breaths. So the difference being that for an infant, when we give the rescue breaths, the mouth should actually cover the nose and the mouth, because the baby is actually really small. Your mouth can actually cover the nose and the mouth. But if it is actually a child, your mouth will not be able to cover the nose and the mouth. So what we do for a child is we pinch the nose, and then with our mouth, you actually cover the child's mouth, so you can deliver the breaths more effectively. Obviously, if you're in a setting in a hospital, everything changes, but we are talking about just, if you encounter a situation in the community. So very quickly, to just demonstrate. So if this is, we're thinking this is a baby, so we said the nose and the mouth. And one other thing that you just need to be mindful of is for an infant, we said an infant is someone who's up to 12 months of age. So for an infant, we don't actually do the head tilt chin lift maneuver. The head should be in a neutral position. It should be in a neutral position, because if you do the head tilt chin lift, which is this, you are going to overextend the windpipe, the breathing pipe, the airway. You're going to overextend, or even if you do this, you're going to block the airway. So whatever intervention you do might not result in a good outcome. So really important to ensure up to 1 year of age, the baby the head should be like in a neutral position, aligned with the body. So just to demonstrate.
See the chest moves when you give a breath. So you need to give 5
rescue breaths.
So in this way, you need to give 5 rescue breaths. So as soon as you give the rescue breaths, you need to check the response. So if you do see the response, again, you call 999, you get help, and you just reassess the situation. If you see the baby drops, the breaths, there is no further sign of life, then you take the further action. And Brother Hussain will explain.
Yes. Yeah. So like Brother Abby said, it's really important to make sure that you actually see visible chest wall movement. And in terms of the recoil, you need to be able to kind of expand the lungs by doing that. So once you have done that, you're going to be looking, listening, and feeling for the breath. And if there isn't anything, very quickly you just sort of you just start CPR. Obviously, if you're in a hospital setting, we also just look at the pulse. And for babies, as you can imagine, because the neck is really short, it's very technically quite difficult to actually feel for the pulse in the neck. So we go for feeling the pulse in the arm here, or we just go for feeling the pulse in the groin, which is actually much easier. So if you can't actually feel a pulse, then we just use a slightly different technique, like Brother Abby demonstrated, which is like we use the 2 fingers. The lower part of the sternum, the breastbone, you place your 2 fingers there, and then you do compressions, which is in a baby, we would say that obviously the recommended compression to breaths is 15:2. But if you're in a community setting and you can't remember 15:2 and all that, just go for 30:2. So we would do like 1, 2, 3, 4, 5, 6, 7, 8, 9, 10, 11, 12, 13, 14, 15, and then you just go back to your.
Then you give 2 breaths. So each 15 compression followed by 2 breaths.
And it's really important to support the neck.
And one thing I want to add here, if you see, you feel child has vomited as situation is not clean as such, and you don't want to give rescue breaths, that is fine. But compression is very, very important. So you continue compression, here 15, 30, that doesn't matter. You need to do continuous compression and you need to call for help, because these 10 minutes are very, very critical. Whatever oxygen within the blood, it will flow towards the different organs. By the time you get the help, this critical time will be a lifesaver. So as soon as help arrives, they will have equipment to give the breaths, like, the bag, mask, valve that we call, that we can, push some oxygen in, and from there the team will take over. So usually it is 5 to 10 minutes, 15 minutes, where every person who is able to do CPR can provide this, the critical intervention.
Yeah, sorry, just to add, if you are not comfortable using your 2 fingers, there's an alternative technique which you may find actually more comfortable, and that is you just use both your palms and you circle around the chest, the lower part of the breastbone, and then you can do the 15:2.
Your thumbs here, right in the middle. So here, you push it like this. Make sure you let it recoil. Chest need to come back in position so that heart fills back with blood, and that blood has to flow back. So again, 2 inches at least that you can push it down. Yeah. So this may be easy. Even like the 1/3 of the chest. You don't need to worry about breaking, ribs. In children, ribs are soft, and very, very rarely there can be any damage to the ribs as such. So you need to push deep enough so that blood can flow towards the organs. Thank you. So that's fine. Shukran, Dr. Hussain and Brother Abdul Salam. That was very useful. So as such, in infants, so this was the infant under the age of 1 year, where your technique is different. So 2-finger technique, encircling technique, encircling where you make, the encircle around the chest, and you press with your thumbs. And rate, you can do 15 compressions to 2 breaths, or 30 compression to 2 breaths. You can do continuous compression. So CPR is very, very important and very critical. While your speaker's on, you're seeking for help, all this. So if we go back to this slide, if we see, as we place the hand, and again, your compression on adult chest, and for the age of, 1 to 10 or 1 to 12, sometimes, our children like 12, 14, 16, they are like adults. But again, to make it simple, if we see, we divide it between the age of 1 and 8, then infants and adults. If you feel comfortable, even for the children of 14, 16 years of age, using both hands, do that, please. So the rate at which we compress or push the chest down is 100 to 120. Imagine, like, the previously a healthy heart was supplying 70 mil with each beat. Now, when you press the chest down, you may be supplying 10 mil, 20 mil out. By your rate, that will make difference. Your depth that we're pressing the chest, that will make a difference. So here, having a good knowledge of how to do the compression, effectiveness of your, the push onto the chest, and the rate, that matters. So when you push on the chest, keep in mind, you have to let the chest recoil, bounce back, so that heart the relaxes and blood flows back in. So again, with further compression, the blood flow out. Okay. So that is the demonstration for the adult CPR. So for the adults, what rate you compress the chest? Anyone? What should be the rate of compression? It should be 100 to 120 per minute. You can put the timer right in front of you and you can count 100 to 120. And how often you can give rescue breaths in between? Every 30 compressions. If you have more people around, every 2 minutes, try to switch over because you will get tired. So recommendation for any CPR that you continue until like person is alive, comes back, you have help arrived, you are so exhausted that you cannot continue. So I think first 10, 15 minutes, that will be very critical and you can make a difference. Okay, so again, for the 1 to 8 years of age, the compression rate is same, 100 to 120. But here, you give 15 compression, then you can give 2 breaths. Or you can do 30 compression while you're in the community and you give 2 breaths. If you can't give breaths, just simply continue CPR and call 999. They will guide you every step. So after this, we'll bring our automated external defibrillator, and we can also show you how to run through that. So in summary, the most important is your recognition of the critically unwell person. Like suppose you are here in the masjid, or you are in the park, or you anywhere in the supermarket, you see a person not looking well, looking pale, looking gray. You approach them, you ask them, are you okay? It may be by the time you get there, the person already on the floor. Because as soon as they lose the output, their functions will cease. They will hit the ground. If it is just because they dropped their blood pressure, as soon as they hit the ground, blood flow returns to the brain and they will be quickly awake. That we call, the kind of syncopic episode where blood pressure goes down. But if they have lost the functioning of the heart, they are in cardiac arrest, they will not respond to you. And from there, you can help them. So early recognition and effective CPR. We mean effective CPR, your hand position, depth, 6 centimeters down. Don't worry about whether you break ribs because there is no legal obligation as such. You are safe whether you break the ribs or you don't break the ribs. Because your CPR, if it breaks the rib, that will be considered as the most effective way you given your input. Okay. So breaking the ribs doesn't mean that you have done damage. Ribs will heal. But your push onto the heart, that will provide the actual output from the heart. Okay. And again, inshallah, we'll continue with these sessions further as well, because important is to know how the heart functions, how we can, improve the function, how the outcome can be improved. And inshallah, Aziz, we'll also invite our community, if they want to arrange these sessions in their masajid, anywhere, we'll be happy to help. So from here, Brother Abdul Salam, he will explain to you how to use AED. So it's automated external defibrillator. When we call defibrillator, it means it's a device which gives a measured amount of electric shock to your heart. But this shock can only be given in certain situations. This machine is very clever. It will recognize that whether this patient needs a shock, it will advise you to give a shock. Okay, you just need to press a button. If it recognizes the rhythms on the screen are coming from the heart, they are not shockable, it will advise you to continue CPR. And the most important is uninterrupted CPR. Once you done 2 minutes, it will ask you to stop. It will assess the rhythms. If it is non-shockable rhythms, it will tell you to continue CPR. The gap between two events, like stopping and this machine assessing your rhythms, it has to be very little, no more than 10 seconds. Because if you stop more than that, it means, that critical time, we're losing that time. So it may be the only window of opportunity to reassess the situation. Okay, so Brother Abdul Salam, please go ahead.
So, looking at a patient that's just collapsed, or he or she, don't be afraid, because you remember you're doing a humanitarian act to save that person with the will of Allah subhanahu wa ta'ala. But anyway, when you see, obviously you don't see patients or people who've collapsed with nothing on, they will have clothes on. Yeah, so don't be afraid. You can unbutton, we have what we call scissors, tough cuts. We tend to cut the clothing, and we tend not to go upwards for a reason, we tend to go downwards. So we cut the clothing and expose the chest, okay? So male, female, child, it does not matter. If there are people about, use the people as a shield. What I've done in the past, when I've done cardiac arrest in a public place, is I've asked people to stand up, who are already standing, and I've asked them to step one further and turn around. So they are actually creating a barrier. So you're creating a curtain, a human curtain. So use people, create a bit of dignity for the patient. So number one, expose the chest, and then more often than not, where I've been, there are things we look out for: piercings, pendants, patches. Sometimes you have pacemakers. And you'll always find people who have collapsed are perspiring. Okay? So these will not stick. Okay? So most important, you haven't got a towel? Don't worry. Use the patient's clothing. Dry the chest, the two areas especially. Also, we also find is, more often than not, people have got hair on the chest, especially the males. I know you won't have a razor, but we do carry them. But don't worry too much, as long as you get a good fix, good positioning, that's very, very important. So, first of all, we have 2 pads. And they are labelled as well. So, as you can see, one pad has upper grey marking on the upper side of the chest, and the other is pointing for under the armpit. Yeah? The reason for that is we need to create a shockable rhythm through the heart. So from here, so it's diagonal, through the heart onto the side. So basically you've got one patch here and the other under the arm. And that will create a direct link, electrical pulse, which will run through and provide that shock. So, without further ado, first pad, it says on the chest. Okay, so it's up above, around the shoulder, just above the chest, nipple area, and basically place the pad and make sure it's stuck on properly. If it's not stuck on, it won't work properly. You will not get full effectivity. So make sure you apply it correctly. The machine will actually talk you through, so don't ever worry what you need to do. It will talk through every stage. So the second pad is under the arm, okay? So you need to place that firmly there, and down it goes. And at that point, the machine will say, analysing. You need to step away. So whilst you're here, make sure there's nobody else nearby. Top, middle, bottom clear. Make sure there's nobody touching the patient in any way or form, and make sure you don't become a casualty as well. So step away. We usually stay quite close. It's usually inch to 2 inches, and we keep our position so we're not constantly adjusting. So stay close, but be wary. And if there is somebody nearby, you can physically push them out of the way because you are saving another casualty, basically. So you're positioned, placed, and now you have to wait for the machine to tell you what to do. And it will say, shock advised. So there's a big red button here. Some are automatic, some are semi-automatic. So there are... So when that button illuminates, you don't hesitate. As soon as it illuminates, press it. But there are fully automatic. So it will do its own rhythmic check and it will advise a shock automatically. And then it will tell you to continue CPR if the heart hasn't restarted. Okay?
So this is very, very important. As soon as you switch this machine on, it will say analyzing the rhythms, which means is assessing the heart. When it says analyzing the rhythm, you must stop CPR. You don't do any further compression. That is just 5 to 10 seconds. It will analyze, it will instruct you, shock advised, shock not advised. So when it says shock advised, it will recharge itself. You don't need to press any button. Once it's recharged, it gives you very specific tone that is ready. What you need to do, you need to press that button here. It will shine, it will basically flicker. So you just need to press that button. So once you press, it will deliver the shock and it will say continue CPR. You don't need to wait for the patient to become awake because with one shock, it may not make any difference. Okay. As soon as you press that button, back to CPR without any delay. 1 second, 2 seconds. Don't think that this patient is going to come back with one shock. Back to chest. Compression, 30 into 2. 30 into 2, a continuous compression. Now, by the time it is 2 minutes, it will tell you again, analyzing rhythms. Yeah? Step away. So it will analyze, then it will say shock advised. Yeah. If it says shock advised, it will recharge. Once it starts flashing, you just press that button. Yeah. And once you press that button, it will say continue CPR. So every 2 minutes, it will do this cycle. So if you have help around, when it is analyzing, that is the time you ask other brother to come, please start the CPR, because you must be tired with these 2 minutes. It's very aggressive intervention. So you need to ask someone, be ready. While it's analyzing, be ready, but keep distance from the machine because there is electric shock going to be delivered. Once shock is delivered, you are safe to approach. Don't think if there is any current running, no. So it basically it's kind of cut off. Only it communicates to the rhythm assessed at the interval of 2 minutes. So you are safe to perform if defibrillator is available. Each pad will give you where to put. If you are not able to, you put your left hand onto your shoulder. You see where the position is? That is first pad. Yeah. Your second hand onto the side. You know where to put these pads. If you are not able to, put one at the front, put one at the back. That's very simple. So because it has to be two positions, like current running from one electrode to another electrode. And even front and back position is fine. Right and left position is fine. As long as the pads are in good contact with the chest, alhamdulillah, you will be able to perform this function. Okay. So we'll switch this machine on and you will see how it advises. Batteries failed. Can you bring the machine from the outside box, please?
And if you're wondering what this is, anybody know?
Face shield.
Face shield. Why? Speak up. Don't be frightened. Protect yourself from any germs, fluids, bodily fluids, etc., blood, vomit. So if we can, use one of these. If not, don't worry, you don't have to do the 2 rescue breaths. If you've got one of these, you can place that over the mouth and the nose and use that. That is a one-way mask, so things will not come through to you. You can only blow down. It will not come back through. No, because there's an area where you can actually give the rescue breaths safely without you being contaminated. So if there's ever, and they're quite easily available from various places, and I've got a few. If anybody's really, I will more than happily hand you one. And another thing as well we tend to carry is gloves. I know you don't have gloves, but don't worry. They're simple nitrile gloves which you can keep in your pocket, in your car, sealed, keep them. And it's just one of those little extra barriers, safety for yourself. If you've got a cut, you don't want to transfer, or if they've got a cut, and you've got a cut, you don't want any transfer of fluids or blood, etc., and so on. But don't be afraid. Don't let that be an excuse not to help somebody. There are measures you can take, okay? So don't be afraid.
So these are the new machines which are usually available in public places. So basically, if you see British Heart Foundation, Royal Mail, and many of the organizations, they contribute towards this. And they supply, any organization can apply and they can get this. And it has to be regularly checked, like every 2 months, that it is in good health. After every use, you need to update on their system, on their website, that it is available, is functioning. So, alhamdulillah, we do regular checks. It comes with everything. They provide you, the pads available. They provide you instruction booklet. So, if we hold this mic, please. So, it tells you lift to open. You open it from here, then that's the machine looks like, okay? So it is basically ready, charged, one-time charge. It will take this machine through 5 years. So because your heart needs very, very little, the electricity just to give that shock or to be delivered that shock. So its battery is so good, but you have to test every 2 months, make sure like it is functioning. So if you turn it on,
plug in cable, stay calm, check responsiveness, call for help.
so
Open airway.
while you're assessing, it will tell you what to do. So you call for help, you open your phone,
Check breathing.
put it on speaker, you start assessing. Check the airways.
Plug in cable.
So it will take you through the steps. You open the machine, you check the airways, check the responsiveness, and next step is to connect the pads. So the pads connection is right in front.
Cable.
So I'll show you the pads that come with it, but we are not going to open them because there's only one pad available, okay? So it comes with full pack. Tissues are there to dry the chest because you need to apply. Chest need to be dry. Because as soon as you lose your heart output, your body sweats and there's a lot of wetness, and these pads, they will not be, the attachable properly. Okay, and also it provides you gloves, everything. So there is a seal, you just open it and it opens the pads. So the connection is very specific to each machine. You cannot use any other type of pads to different machines. So only specific pads that you plug it in.
Plug in cable.
So yeah.
Adult pads.
So it will recognize the pads.
Attach defibrillation
So-
pad to patient's bare chest.
So what
Start
type of
CPR.
pads? Because if you're using pediatrics, it will recognize these pediatric pads, like for the children. If it is for the adults, we only have adults because they only supply one type of pads. So This sound is basically your CPR. So once 2 minutes over, it will assess the rhythm. We'll just keep it on.
Continue CPR.
It will advise you to continue. Okay? Because these are not attached, it's not basically reading anything. Okay. Jazakallah. So that will be the voice coming out of it, analyzing rhythm. Then it will say shock advised. When it says shock advised,
Push harder.
push harder. So it will also check how much you push. Yeah, it will not letting you to just, the function very lightly.
CPR.
So if you look at this machine, there's a button right in the middle. So once it is charged, fully charged, it will tell you to press on that button, so it will deliver the shock. Okay? So this way it will continue the cycle. So in certain situations, especially drowning, electrocution, basically you need to do CPR for a long time. Even in the hospital settings, when we do 1 hour, 2 hour CPR. And we have machines which can compress the chest because, the staff shortage and not many of the nurses, they can continue long. As a doctor, we only lead, we just stand at the leg end. We just instruct them how to do this. And we have machine which is automated to compress the chest, and we continue even 1 hour, 2 hours. Because sometimes if your compression are good enough, their brain function will remain in good health. As soon as, the machine detects the rhythms are shockable, it will deliver the shock, and heart will flip into normal rhythm. And then it will start beating normally. So that's where it works. But if time is written, your efforts, you may feel like, you couldn't do anything, but alhamdulillah, you will be rewarded because that's the way it works. That's the humanity. And we are here only to try our best, nothing else. So we continue to try until we have the help, and then we go on from there. So this machine is available right at the front. Any situation comes within the masjid or outside, you ask for AED or defibrillator if you are able to remember. Otherwise, anyone around who knows will bring the machine. And your duty is just to start the CPR. And very, very important in these situations, don't lose your nerves. It is critical situation, but your patience, your calm will make a difference.
Start CPR.
So that's the way it is. So inshallah, Aziz, we'll divide into 4 sessions. Basically, I think we have only 3. But I just want to talk a little bit about different conditions. One is epilepsy. Epilepsy is quite common in the community, and we'll just turn this one off. Whenever there is epileptic attack, means seizures, patient will have, the flopping of arms, twitching of the face, breathing goes harsh, and they can, bite their tongue, they can wet themselves. All these are basically brain function, the brain control becomes very abnormal. So in this situation, when you see anyone with this, you need to put them in recovery position. Recovery position, alhamdulillah, we all know the sunnah way to sleep. That's the way it is. You need to turn the person onto the side position. People in this situation will be very different from our brother because they will be very stiff. Their legs will be in tone, their arms will be very stiff, and it will be difficult for you to turn them around, but you have to push them onto the side. So pushing them onto the side position, what will it do for you, for the patient? Because this patient will be actively bringing secretions up. So these secretions, they can go wrong way towards the lungs. Your aim, bringing patient into the recovery position is to prevent that aspiration, that secretion to go to the lungs. So as soon as you see the demonstration, Brother Abdul Salam he's doing. And in those situations, as I mentioned, legs will be very stiff. You will not be able to relax that. You can try, but it will be very difficult. So just try to push person onto the side position. Just roll onto the side. That's important. Okay. So you check the pockets. Sometimes sharp objects can be in the pocket that can cause damage. Again, so you put your hand, under the cheek. That is one thing. So you turn them onto the side. So face is onto the side, slightly down, which will bring any secretions out onto the floor. And they may vomit as well, because all bodies in that situation where body contracts. Even heart muscles, abdominal muscles, they contract, and it can vomit. No. As soon as seizure is continuing, you just change them onto the side. You don't wait seizure to terminate. So, because during the seizure, they will bring a lot of stuff up. And that stuff can be aspirated, can cause aspiration pneumonia at later stage. So you just turn them onto the side. That's one thing. It will help in their breathing, because when brain function is lost, is out of control, your tongue can drop back. As tongue drops back, it can obstruct the airways. So this is a recovery position, and also you call for help. Okay. Other than that, you cannot do anything in public. So that's one thing. So second, that's fine, brother. Shukran. You have a good rest, mashallah. And the second aspect about asthma. Asthma is very common. Patient can have acute severe asthma attack under any situation, like weather condition can affect, allergens can affect, sometimes food contents can cause allergy. Again, dust, smoke, all these can trigger. So in these situations, you put the patient in upright position, or we call it maybe 45-degree position if you are able to. This will help to ease some of the symptoms, and you call for help. If they do have inhalers with them, so use those inhalers to give some inhalation. 2 to 4 puffs, 6 puffs, 10 puffs, whatever number you can get them in. So this is basically, the proper position. We can bring it further up, even sitting upright position. Sometimes these patients, they are so difficult in breathing, they prefer to sit on the chair, their chest forward, so they can ease their breathing. So if you do have inhalers or spacer device, you attach them and give them breaths. And even up till 10 puffs, that will make difference, and call for help. And other is electrocution. If it happens, important is your personal safety, turning the switches off. Don't touch the patient until there is a disconnect. Then grab the patient from the safe area where there's a clothing, or you use something to pull that patient away. And as soon as there is a disconnect from the electricity, then you will be safe. And in electrocution, we call it reverse CPR, which is mean patient may be dead because electric shock is so severe, is high voltage. Reverse CPR means you starting CPR on a dead person, and you may need to continue 1 hour because their heart is in shock and it will just flicker. This is the situation. And this will continue, until heart own stimulus take over. You need to do CPR for 1 hour. But your job is first 10 minutes. As soon as you start CPR, call for help, team will come and will take over. So that's very important. Other is drowning. Drowning could happen even at homes. Little babies, they are given bath, they can drown. And drowning, another thing where we do very prolonged CPR. The immersion, submersion, these things. But important is, if patient is unconscious, not breathing, then first you turn them onto the side, any water that goes out of the airways, then you turn them straight onto their back and start the CPR. Your CPR will push any water out, and intermittently, like you might need to tilt them to get the water out. So inshallah, Aziz, we'll close here just for the Salah. After Salah, we'll stay back just for 30 minutes. We'll do hand-on technique. So we have these dummies, so every brother will be equipped how to perform the CPR. Inshallah, will not take more than that time. Your 1 minute CPR will teach you like how to do this, because the only thing will help this patient is the CPR. Your CPR, uninterrupted CPR, calling for help. So inshallah, that will make difference. So soon after this, after the Salah, we'll continue the session. We'll divide into 3 groups. I'll be at one station, Brother Abdul Salam at another station, and we have Dr. Hussain on the pediatric station. So inshallah, it's just a quick one. So that is even more important than this session that we have conducted, because this was basically basic knowledge, but hands-on technique, that is the key. Okay, Jazakumullah khairan for your patience. I know it was a bit long session, but again, if you do feel that we have to have these sessions again, we are happy to arrange them. And one thing, brothers, please remember, once we finish the session, we have some feedback forms. Please take your time, fill them in. You take them home. Once you've done it, take a photo shot and send it to us. So, Jazakumullah khairan wa ahsanul jaza.